Hi, this is JP Salibi, and this is Elevated Medicine Podcast. And I want to open this up right before a nice interview with one of our patients. I want to say that Nikki Cook, the main patient being interviewed here, gave us explicit permission to use her name in public and tell her story, her journey with us from being very ill to being quite well. So I will turn this program over to our host, Charles, and our chief nurse practitioner, Chris Jackman, for the rest of this episode. Hope you enjoy it.
All right, so everyone, welcome back for another episode of Elevated Medicine. Tonight we have Nikki and John Cook. Did I pronounce that correct?
You did, yes.
Perfect, perfect. And Nikki is a patient here, and I'm just going to ask you some questions, Nikki, if I can, just to get us started.
Okay.
First, I think it would help everyone if we knew a little background. What brought you to Carolina Holistic Medicine originally, and what were some issues you were hoping to fix?
Okay. Well, originally, my husband was actually the reason that we started coming. He had an increased heart calcium score, and his primary care doctor wanted to immediately put him on statins, and they didn't give any other optional or alternative treatments. They just recommended that. And I was concerned because I had heard that statins had, several, side effects, and that once you go on a statin, you probably don't come off. So I was interested in learning if there were other alternative treatments that we could, consider. So we reached out to a functional medicine provider for that. Once he started feeling better and all of his labs became in an optimal range, I was jealous and I thought, I want that for me. I was had problems sleeping. I had some anxiety, and I just was tired all the time, fatigued. So I thought, well, I want to be optimally healthy. So that's when I started going as well.
Okay. Okay. Very good. Now, before being seen in December, mid-December, what were some health issues or symptoms you were having at that time? And then who did you see for these originally, and what were you being told by them?
Okay, so I started to feel sick in, I would say, spring to early summer of 2024. I had just symptoms that didn't make any sense. I was losing my appetite, unexplained weight loss, which was obviously because I wasn't eating as much. And I wasn't complaining at the time because who doesn't want to lose a few pounds? Um,
Right.
and I didn't really think too much of it, but it didn't really make sense. Why was I feeling that way? I also had several fainting spells during the night, which were unexplained and I didn't understand. Around that time, my insomnia worsened. And I also traveled. Our oldest son lives in Hawaii. We went to see him. And we also went to Florida. And both times I ended up in the ER with a panic attack, which I had never in my life had any sort of panic attack, let alone severe anxiety like that. So those were unexplained things. Um, I saw, let's see, doctors that I went to for treatment. I went to my primary care doctor. I went to an OBGYN doctor. I went to a menopause specialist, a GI specialist, a psychiatrist, and a dietitian. And again, I had another trip to the ER here in Charleston. So 3 total trips to the ER. And each of them told me that really my symptoms must be caused by hormonal changes. Um, they couldn't explain them. My labs looked normal to them, or they chalked it up to psychiatric issues.
Really? Okay. Okay, now let me pause for a second. John, let me get you involved here. What was it like for you as a spouse to see your wife going through this? Tell me about the emotional, ride that you were on and what you were experiencing as you saw her health sort of degrade.
Well, at first, I saw things were out of character,
Hmm.
and I didn't know if this was this perimenopause that I'd heard about. But things really got wacky, the closer they got to, the December when we really sought help. Um, it was pretty tough to see her go through it because a lot of people kind of thought she was just losing her mind and losing her marbles. And I knew that was not the case. Just knowing her as long as for 27 years, I knew what was going on with it. So pretty helpless. We were very fortunate that we were in a financial situation to be able to support trying about any and everything out there. And also the fact that I'd recently retired and I was able to devote all my time to being a caregiver. So that was very fortuitous for us.
So you're in a good position for it, but tell me about, because I think a lot of spouses now, especially as longevity increases, they're put in a position of having to be a caregiver. Tell me what that's like on you to have to sort of step up and be the caregiver.
Well, Nikki had always been the homemaker of the house, taking care of whether it's pets and kids and just making sure everything is rolling correctly. So it was a complete paradigm shift in regards to just the way we function as a family. But then, just I would just say it was very trying at best. Sometimes, she was, as she noted, her mind was no longer operating correctly. She had insomnia that obviously fatigue throws a huge stress into things, but insomnia was off the charts. Her personality was changing tremendously. Anxiety, everything was off the charts scary for her. Loud noises, anything in the house. It was almost like just get the kids out of the house, and they're adult kids, but just get them out of the house so that we could best provide the support that she needed. And then finding it was I felt very helpless because I was outside of my field of expertise, and there was 3 different times that we went to the ER and I said, hey, I'd given up on my ability to fix it. And I was just like, can you please stick a feeding tube into my wife? Because I was convinced that we were going to lose her.
Wow.
So it was kind of tough as we were starting to I was preparing for what life was going to be like without her. So.
Wow.
And I'll just say too, prior to this all happening, and I'd seen Nikki a few times and she had been seeing other providers in our practice. I mean, outside of some sleep issues, which lots of women go through, and maybe a little hormonal imbalance. I mean, she was a healthy person. And that's what made this so odd was this email I got on a Sunday in mid-December, and she was like, things are bad. I need to see you. I'm expecting her to say, her to come in and be like, I haven't slept in 3 days and I'm just exhausted, or like my fatigue's through the roof. I was expecting something like that. Like, it blew my mind when she walked through the door that Monday morning. Like, she looked like excuse me, it sounds terrible, like a walking corpse, rail thin, pale, like barely able to even walk on her own 2 feet. It was shocking, and nothing that we had ever treated for or even talked about in the past. Like, this was it came on so quickly. It was very scary, even for me. As she walked in, I'm like, am I going to be able to do something here? Or is she too far gone?
She had lost 25 pounds in November alone. That was on top of the total 50 that she had, at the end of it. So she hadn't been driving cars. She hadn't been doing anything for a long time. But 25 pounds on a frame that was already pretty thin was substantial.
Well, Chris, you mentioned the visit. Okay, so Nikki, tell me this. After contacting Chris and coming into the office in mid-December, what were the takeaways from that visit for you?
I guess I at that point, I felt like things were dire, and I could see on Chris's face that he thought things were dire at the same time. And I finally felt for the first time that somebody in the medical profession understood what I was going through and wanted to help me. Because at that point, I didn't feel like there was anyone who understood what I was going through. One of the things I wanted to talk about was the symptoms that I was having, because they're extensive and they're just so crazy. I have a list because there's so many. But I had extreme bloating and fullness. Like I felt like I couldn't eat anything. My stomach was, I wouldn't eat anything, but I felt like I had been to a buffet like 10 times, which
Wow.
didn't make any sense to me. So just, I was so full feeling all the time. I had extreme anxiety, just literally felt out of my mind. I had brain fog. I was, like we said, unable to eat or sleep, which was just crazy.
That was 4 hours of sleep with one Ambien and two gummies
Yeah, I
each
was,
night, and she could get 4 hours. And that was it.
yeah.
Wow.
I felt like my body was in a state of constant fight or flight, which was scary and just made it so that I couldn't relax at all. I was intolerant to noise. I tried listening to spa music and relaxing noises, and even that was just too much for my brain to be able to deal with. So even like having the kids in the house and conversations and phone calls, I really wasn't able to do things as simple as that. I had severe nausea, which, made it so that I didn't want to eat anything. My hands would be shaky when I'd go to reach for things. I had a lot of UTI symptoms, burping, which I don't have that, overall fatigue and exhaustion. I was extremely emotional and tearful. I would cry all the time, and that's just not my personality. I had vision changes. I felt like my vision was worsening during that time. I had severe diarrhea, muscle spasms in my legs, memory and recall issues, and I was unable to regulate my body temperature. So I had all those things going on at one time. So I was thankful to be able to see Chris and for him to understand. And he was the first one who was willing to really help me.
So, Chris, I got to ask, this kind of just brings up a question. As a provider, when someone comes in, I know we see a lot of patients like this. How do you begin to sift through all of those symptoms?
Yeah. So, um, nothing prepares you for that, right? So it doesn't matter. Like, yes, we see patients who are very sick, and yes, we help a lot of very sick people, similar to Nikki. But like I said, she walks in, and I'm expecting some, sleep issues, fatigue issues, maybe some GI problems, and and then she lays that list down on me,
Yeah.
and I don't I try my best not to show it, but yeah, in your mind you're thinking like, oh my god, like what am I gonna do, because that list is exhaustive, and it's like, and like I said, you start to wonder, like, is she too far gone, like did she get here too late? So the initial shock hits, and you're kind of like freaking out a little bit as you're listening to all this stuff, and then you have to kind of slow your brain down. I like, making all my notes and just kind of start looking through things and start saying, okay, what can we get turned around now and stop the descent of her health and at least stabilize her, and then we can find something to build on. So that's what I did. I kind of went into crisis mode of like, what you would do if you found someone with a big gash on the street. You stop the bleeding, right? That's the first thing you do, is you stop the bleeding. So that was my goal, was just to get her to feel like she's not getting worse. And then as we talked about her past a little more pre coming to Carolina Holistic Medicine, we started getting more of a picture of what may be going on. And I mean, I threw the kitchen sink at her a couple times, and no idea if it was going to be good or bad. I told her, this is a lot, and we'll see how your body responds. But luckily we got very fortunate, and her body responded perfectly, like by the book is what you hope for on everything we did. So yeah, a little bit of shock and awe at first, but then we kind of regrouped and started working through what can we fix now and what can we try to get better over time. And I was very realistic with her. I said this could take a year. She didn't like that answer, but I told her this could take about a year to fix. And she said, I don't have a year. I'm not going to make it a year. And I was like, I'll do the best I can, but we have to also be realistic here. Yeah, it was it was one of the more challenging visits I've had in my career for sure.
So it sounds like you triage the symptoms then. And
Yeah.
like you said, stop the bleeding first. That's interesting. Now, you mentioned she starts to improve. So, Nikki, tell me about how quickly did you start to notice improvement in your health, and what interventions seem to help the most in the immediate and over the long term?
So when Chris saw me, he was right away like, we have to start you on ivermectin, and I'd like to start you on supplements of the McCullough protocol. So I was able to get the ivermectin that day, but the McCullough protocol supplements were going to take a few days to come by mail through FullScript. So I would say that amazingly, within 36 hours of starting the ivermectin, I felt my first bit of relief in months. And I was so thankful. And then the other supplements came that he recommended. And, you know, it was very, very slow, but I was feeling improvement, a little bit of improvement each day. I was so sick and I just didn't want to be like that anymore. I wanted to be as aggressive as possible with my treatment. So I would say to Chris, what else can I do? Well, do anything. So I have a list for that too. So I did the medications and the supplements, but I also started red light therapy. I did the infrared sauna. I did Myers cocktail and glutathione IVs.
Over and over again.
Yeah, I would try to do it once a week. They're expensive, so I did them as I thought was reasonable. At the same time, I was seeing a therapist previously before we kind of figured out what this was, because they really thought I was having mental health issues. So I was seeing a therapist, which was helpful with, you know, trying to get my anxiety under control. I utilized deep breathing techniques for the first time, which I never had used before. Also vagus nerve stimulation to try to get my body to relax. Prayer and meditation. I talk to God every day about, please help me get through this. Walking, being outside in the sun, as hard as it was for me just to simply walk around our property, I tried to get out and be in the sun as much as possible and get just a little bit of exercise, which was very, very difficult. And then the last thing I did was true dose therapy. I went to Florida and had that done.
You
Very
know,
good.
it should be noted that within those first 36 hours, I saw my wife's personality for the first time in like literally almost a half year, certainly within the last 4 months. And the next morning she woke up and felt terrible. Chris, I don't know if you can bring up the Herxheimer's.
Yeah. Yeah. So a lot of times what we see is, you know, we start to make progress, but as you break down these biofilms and, you know, Nikki was dealing with it was vaccine injury, correct? That you had originally got the vaccine and she had a terrible response after the second one, I think it was, correct? Or
No,
is it
I only one, just the Johnson &
okay.
Johnson.
Okay, you did the Johnson Johnson one shot. Yeah, and after that shot, you know, severe reactions, you know, no cycle or period for months, you know, and this was stuff I wasn't
Yeah,
completely aware of.
well, I got the vaccine in August of 2021, and I was reluctant to get it, but I felt extremely pressured by family and friends and the media. So I ended up getting the one shot, and within about 4 to 5 hours, I had terrible flu-like symptoms, a high fever, knocked me in bed for 24 hours. After that, I had migraine headaches for 6 weeks, and I lost my period for 10 months. But then everything kind of came back, and I felt, you know, I had 3 years where I felt normal, you know.
Yeah, and that's
And
what made it so tricky. It was the length of time between all that and this. It was hard to connect those dots until we were kind of in that office on that day thinking, well, what could this be? And then we discussed that and kind of thought, at least that's something to go after, right? We don't know exactly what's going on, but at least that gives us something to treat. So let's try that off the bat. And that's when we went, you know, high dose ivermectin and some things to break down the biofilm and to help detox But when you start breaking down biofilm and you start trying to detox the body, your immune system's gonna not like that, because now you're kind of you're attacking things, you're breaking up biofilm, it's spreading throughout the body, and your immune system's like goes into chaos mode, fight or flight, and it sets off an inflammatory response. And that's what she had about, once she kind of like hit that, oh, I'm feeling better, then boom, the Herxheimer reaction kicks in of your body, like, hey, something's going on here. And that's tough to work through, because you can feel like you finally have hope again, and then it gets snatched right back. And if you're not aware of what a Herxheimer reaction is, it's very easy to be like, to just give up and be like, you know what, it didn't work. I thought I was going to do it, and it didn't. But luckily, she contacted me. We talked about what probably is going on, and just said, push through, or, there is a light, and she did that. So, yeah, that can be a scary moment, but she did well with it.
How long did that period last, the rebound there?
Really, just I would say a couple days. Luckily, I would say 24 hours was really bad, and then so it was a little back and forth. But overall, it was just a little period that I had to get through.
And she combated it with Herxheimer. I mean, with going to get an IV with a Myers cocktail and the light, and also massage, and trying to just get things going.
Sure.
Yeah, it's the good and bad of being aggressive, right? You're going to be aggressive. You have the potential to get great outcomes very quick, but you also have the potential, you're stirring up a lot of things in your body very quickly as well. So, we had that conversation. I'm like, look, we can do as much as you want, but it's not going to be a fun ride. Like, it's going to be a roller coaster like you've never been on. But and we can maybe cut that year down to a few months if we're extremely aggressive. And she felt like that was her only option. If she was going to survive this, that's what we needed to do. So we did it.
Okay. Well, how many more visits did you have after that initial visit, Nikki, before you felt recovered?
Amazingly, I had the one visit in December, and then I probably had some phone calls and emails back and forth with Chris a little bit. And then I followed up with him 4 weeks later, and I was doing much, much better, but I still felt like I wanted to be aggressive with my treatment because I wasn't doing as well as I wanted to be, and as quick as I wanted to be. So he added a few more medications, the low-dose naltrexone and the amulexinox. Is that how you say it, Chris?
Yep.
And I started a detox protocol also. And amazingly, within like 2 months, I felt like I was on the road to recovery completely.
Wow.
Feeling so much better.
Wow, it's really quick. John, let me get you in here. So you're watching her kind of go through this ebb and flow. What's it like as sort of the supportive spouse when you see her start to come out of it? Emotionally, what's that like for you?
Well, there was multiple times where she had given up, and I was just like, no, we're going to keep this fight. We're going to keep going, stay strong on our faith and our family. But she went from being very, 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 very sick to very, 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 very sick. And that is a huge transition. Like, there's 3 less varies. I could see it. Nobody else could see it because she was so terribly sick. But it got so right after Thanksgiving is when we saw Chris, and then 2 weeks later, I hadn't bought any presents for the kids, and we hadn't gotten ready for Christmas or anything like that. But I knew it was going to be the merriest Christmas ever, because I knew there was a future for us. So there's a lot of roller coasters there, but when you're on the other side of something really bad, life's we could live in a shoebox right now. I don't care, just as long as it's us.
Sure. I understand. Well, let me ask you one more question here.
And that's the thing I want to add, because I talked to them about this as well. And that's why I'm glad John's on. I see lots and lots of sick people, and the strain that puts on a marriage is unbelievable. When you have a sick spouse and one of the spouses has to be the caregiver, it can, and especially not to, bring like male, female into it, but when the woman is very sick and the man has to now be the caregiver and take care of her, it tends that the man tends to kind of run out of patience very quickly, and it's a huge strain on the marriage. And I have many patients who have gotten, divorced or separated due to the health issues of one of the other spouses. So, you know, another part of the reason why it's important to get this moving in the right direction quickly is no matter how close your bond is, it's going to be strained when you have one person who's very sick, and the other person having to do all the work, and they're kind of like, is this my life now? So that's another part. And he was at every visit. He was a part of every email, phone call we had. He was a key player in Nikki's recovery, just as a supportive spouse.
Great points. Great point. Let me ask one more question. Nikki, John, what would you tell other patients who may be feeling similar things or going through similar circumstances as you've gone through, and then maybe they're not getting the help they need from traditional medicine?
Don't give up.
Yeah.
There was so many times we could have given up. We have so many misleading information coming from people because this is so, I'd say, cutting edge.
Mhm.
We had one of our doctors, when they found out her spike protein levels, said, I don't know what to do. I think you should go get another booster shot. And we were like, what?
Really?
So we heard everything. And a lot of people, the psychiatrist he was like, you're lucky, your husband's still with you, because a lot of people will leave during this period. I think if we hadn't fought through it, you would have been in a psych ward and stuck with traditional care that would have never broken down the spike protein, and you'd be, I don't even want to think about it.
Yeah, I would definitely say do your own research. Unfortunately, the traditional medicine and Western medicine, as most people go to, doesn't have a cure for this. The FDA does not have treatment, so you have to look other places. I absolutely go to functional medicine. Without it, I don't know that I would be here right now. Everyone wanted to blame my symptoms on hormonal and psychiatric problems, and that wasn't the root cause. And I'm so thankful that Chris was able to find it. What else?
We would go to some doctors and you could tell right away whether they were going to even tolerate the discussion of a spike protein. And one doctor said, listen, this has challenged everything that I've learned, and I don't even know how the system works anymore. And we thought he was going to be on one side, and he wound up being on our side so much. And he was literally Googling while we're telling him this stuff because he hadn't even seen it. It was so cutting edge. So,
yeah. And one thing that you have to go outside the box. I don't think many people would say go to the internet for your healthcare advice, but I found a long COVID Facebook page that was so instrumental in helping me, and to see that other people were going through the same things. It's comforting although you don't want other people to suffer, it's comforting to know that other people are going through the same thing as you are. And I got so many great ideas and treatments, and just the Facebook page is very uplifting. People are on there because they are looking for help or they want to help other people. So since I've had such a great recovery, I feel it's like my duty now to answer as many questions as I can because I just want to help as many people as I can. I'm so thankful for this podcast because I had been praying to God that through my suffering, I just wanted something positive to be able to come out of it, and I wanted to be able to help other people. And I didn't know how to do that. And then Chris, a few days later, asked me to be on this podcast. So I'm so thankful that my prayers were answered. And I hope that through this podcast, I'll be able to help people who are sick, or they have relatives who are sick, or providers who are looking for treatments. I can tell you what I did worked, and I'm so thankful for that.
Well, I'm glad to hear that. I hear a couple themes here before I hand this over to Chris. I hear taking responsibility for your own health. You really have to do that. Engaging functional medicine, a provider like Chris who thinks outside of the box, because traditional medicine just couldn't even really wrap its head around it. I thought that was interesting when they said to have another booster. That's gonna fix it. I hear the need for a support network for not only you, Nikki, but for your caregiver, and then just the role of faith too, and how that's helped you through, and how that's been so important too. Well, I want to thank you for this discussion. I'm gonna hand this over to Chris now, so he can talk about Nikki's case as well as patients similar to Nikki and how they've gotten better with off-label treatments.
Yeah, I think Nikki is a great case. Now, what I think is important to understand is, you know, it every patient's not going to have Nikki's outcome of like in 36 hours you're feeling better, and in 8 weeks you're
Yeah.
healed. So I don't want people to get the idea that it's like if they're sick near death, like give us a call and within 3 days you'll be better. That's not the point of this. The point is that there is options, there is hope, and we're willing to do the things that other people aren't, because we're not so hamstringed and tied up by the insurance model or the Western medicine model. We can think outside the box. So we can use off-label medications like ivermectin or amloxanox, and we can use a variety of supplements, and we can, recommend things like, red light therapy and infrared sauna and acupuncture and all these type of things that other people just think, oh, that doesn't actually do anything. And, Nikki's a shining example of why it does work. So, what I want people to understand is, one, like they said many times, don't give up hope. Keep trying to find somebody to listen to you. That should be the absolute bare minimum of what you get when you go see a provider or doctor, is they listen to you. But unfortunately, that's not the case. You go in and they kind of pass you off and say, it's in your head, we'll set you up with a psychiatrist or a therapist. But listen, and try to, our goal is, like I said, to try to just find what is that root cause. We're not trying, she said she had all these symptoms. I could have tried to go after each symptom individually and try to suppress them with medication or things like that. And eventually this medication to stop working, or she would just not make it, because we're just suppressing symptoms. But we went after a root cause. You fix that root cause and everything else kind of comes in the way it's supposed to. So that's the key takeaway from Nikki's case is have hope, do your own research, find somebody to listen to you, and be willing to, as long as it's not going to hurt you, be willing to try things. Like John said, they had the financial means to do a lot of things, and a lot of people don't have that. But, we're always willing to try to find things that work within your budget, and try to get the best bang for your buck that we can. So trying to use off-label medications and supplements to treat things that Western medicine just hasn't done the work to try to figure out how to treat is very important. So we do all of that. I'm not an infomercial for our company. It's more, this is educational to people in Nikki's situation. But, I just think it's important for people to understand that her story is not unique. There's lots and lots of people like her. And I hope those people continue to fight for themselves and not just take the easy path and say, okay, this is it. There's no hope, because there is. You just gotta work to find it and have somebody in your corner.
Great. Nikki, John, any final thoughts that you want to put out there?
I'm just so thankful for this platform, that I hope that that people and providers are listening and can listen to my story, and no, don't stop fighting. Don't take no for an answer. If you feel like something isn't right in your gut, like, listen to yourself. But you know yourself better than anyone else. So keep going. Don't stop fighting.
John?
Keep up the fight, fight together and win. Don't give up.
Well, I got to tell you, your story is very inspiring to me. Not just you, Nikki, obviously, but John, you just how much you've supported her and your relationship. So thank you so much for sharing that with us tonight. And I really do think this is going to help people, if only to encourage them, in very difficult circumstances. Chris, do you have any final thoughts?
Yeah, just if you feel like you don't have options, you feel like you don't have support, obviously we're here to help. But like Nikki said, find Facebook groups, find social media groups, find someone that with like-minded people to kind of share. And even if you don't follow you don't have to do everything they say because they say it worked for them, but at least it gives you a sense of community to know that you're not alone. And then as you recover and you get better, pass that on, pass it forward to the next group of people like they're doing. So yeah, my big last takeaway is we're all here for the same reason, to try to help people and try to make everyone's lives as best as possible and you're as healthy as possible. And look out for people, fight for people, and listen, because that's the best thing you can do as a provider or a friend or a spouse is listen. Even if you don't have the answers right away, listen and at least let them know that you care. I think that's the big takeaway.
Very good. All right. Well, I think that's pretty much it. Chris, you got anything else you want to talk about?
No, thank you guys so much for being on. I really appreciate it. Your story is amazing. The amount of excitement I had, when I saw you the next 2 times after that first visit, it is. I feel I'm as happy for you as you guys are as happy for yourself. So I really do feel that way. So thank you for doing this, and I'm truly am very happy, and you guys are very blessed. So we'll keep up the good work, and we'll keep you both feeling as good as possible.
Good. Thank you so much for everything, Chris.
Yeah, it was really nice to meet you guys. Thanks for sharing. I know this, private health issues can be very private, and I appreciate your willingness for the benefit of other people, come on here tonight and share your story.
Yeah,
It really
thank
was
you.
inspiration.
If anybody wants to reach out to either one of us, in particular Nikki, she's talked to a lot of people
Well, not a
already.
lot, like a handful of people I've already been able to touch base with who are having issues. So I want to be able to help as many people as I can.
Anybody wants to reach out, please do.
Yeah, great. Thank you. Thank you. All right, Chris, was there anything else you needed?
No, that's it. Thank you guys so much.
Thank you, guys. Nice to meet you.
You too.
All right, good luck. Take care.